Hey, this is Matt. Welcome back to the video where I would like to share one of my subscribers before and after results after his surgery. And he was so kind to offer me these photos despite his hair transplantation not turning successful. We will take a look at why did he get a bad hair transplant result in the first place, so you guys can learn from it. And as a thank you for his photos, I'm gonna also offer him my suggestions, what I would do from this point on to make this as good looking as possible. All right, so make sure you stay tuned until the end. As always, before we start, this video has been brought to you by GoFiber, which are hair building fibers you can use to mask any thinning or patchy areas on your scalp to make your hair look thicker and better. So make sure you check out the link in the video description below where you can visit GoFiber, get a free sample of your choice and try them out. See if you like them. Before we take a look at his surgery, let me give you a little bit of background on him. We can see him being before his surgery, somewhere around Norwood 5. He's diffusely thinning, Norwood 5, with still enough existing hair in the mid-scalp, especially existing hair that still could be thickened with treatment, and it would be worth thickening such hair because we see clearly that it still has some nice density, and if you get a hair transplant around this, you can still rely on that existing hair to give you more fullness into that final result. So unfortunately he did not take any medication before his hair transplantation. That's also one of the mistakes, and it's a real shame that he hasn't started with treatment before the surgery, because if we take a look at the crown area, although it's diffusely thinning, it's visibly thinning, we see that the density per square centimeter is still pretty good, that even hair restoration wouldn't be necessary or even recommended in such case. Fortunately, his donor area was also pretty decent. On the sides it's looking average, but from the back it's actually looking pretty good. And right now let's talk about his hair restoration. As you can see, he got FUE done, follicular unit extraction. Supposedly he got 2500 grafts, which I don't think he got, because after counting it more precisely right here, I came onto like 1200 right here, which was like the frontal third, and to the left and to the right I separately counted it because it was more visible. I counted another 450 grafts. So I would say the whole front is definitely not more than 2000 grafts, probably somewhere around 1600, even if we take this area. So the rest, which is here, and you see that the density is super low, so it can be another maybe 200, 300 grafts most. So overall it's definitely not more than 2000 grafts after my estimation. So this is the first issue I have with that hair transplantation, before even talking about the outcome of this surgery. One issue that I have right away with the design is that he shouldn't have closed the temple or frontotemporal transition the way he did, or the way the clinic did it with him, considering that he has that Norwood 5 potential. I would have done something like this. I would have left this area bald, or what I would have done would have been something like this and this, instead of doing this type of closure here. You just waste too many grafts and you kind of put yourself at risk of, you know, having too much framing in the hairline, while being a Norwood 5 potential, or even worse later, you are not on a treatment. Why would you try to square off that hairline so much with the first surgery already? This seems to me like a day number 10 to day number 14 after the surgery, when the scalps are already looking dry and they start to fall out. I mean, the crusts, as you can see here. This is when the hair starts to fall out after week number 2, week number 3, until the month number 3, and that's the shock loss pretty much. Looking at the after result, and specifically maybe evaluating this area where roughly 2000 grafts had been grafted or less, this is actually a pretty good outcome in terms of coverage, in my opinion. But he's lucky because he has a pretty good hair caliber. It's kind of thicker, and also the texture of the hair is not entirely straight. So this actually plays into his advantage. We see one patchy spot already developing behind the transplanted zone, and that's because he's not on medication. And we'll start seeing how this hair in the mid scalp, which was the most preserved hair before the surgery, it starts to thin over the next couple years, and you will notice how there will be that transplanted island of hair in the front, and the rest will be looking much more thinner. Here it also seems like some of the areas didn't grow in as perfectly, but again, the density wasn't so good, was it? So that was to be expected. We noticed that this area is looking better. Also, these areas on the corners, we have noticed that the density that was transplanted there was fairly good, but also here it's looking better, but then the other area here, it's also looking pretty patchy. So this is not very good and definitely requires another touch-ups. And what you are looking at right now is his hair situation right now, 2 or 3 years after the initial surgery. And we can notice how the mid-scalp hair thinned out even further, and even the transplanted hair doesn't look as thick anymore, partially because it's shorter, but also we notice that the angles are way too high. The angles of the created recipient sites are way too high, and you can see how it all makes that transplanted hair look more wiry, and it's looking like a brush. It's not kind of falling flat on that skin, but it's going like that. You can notice it also here. And this is probably the worst area when you notice if the angles are too high, it's gonna cause the most troubles on your hairline in terms of styling that hair, and the hair will just misbehave a lot. And this is this area which is being combed right here. Okay, you see that? It looks as a horn. You will have the impression as if you had like horns growing out of your forehead, because these angles are just way too high in here. Okay, he also provided us with great footage of his donor zone, and unfortunately it's not looking very good. As you can see, we see over harvesting, which is totally unacceptable for 2500 graft FUE surgery, and the over harvesting is mainly obvious in the lower portion of the donor. Fortunately, the higher portion is still fairly good and it could be utilized for the next transplantations, but this lower portion is very patchy. If we zoom in, you can notice how the homogenization pattern of the extractions has been completely disrupted, and we see so many extractions being done from 1 square centimeter of that donor zone. There is no way a good doctor would have done it this way. Okay, we can also see it here. All of these areas, we can see that the density per square centimeter has been decreased in more than 50% in the first surgery already. It almost looks as if 60 or 70% of these zones, which you can see here, has been decreased. 60 to 70% of the density, which is totally unacceptable. Okay, so this is permanent over harvesting, and it can be avoided by a doctor or technician extracting the grafts from the donor in a homogeneous pattern, where there is only maybe 30% of that donor density per square centimeter reduced per session, and not more than that. And despite all of these flaws, like over harvesting, unnatural angles, unnatural design, especially on the corners for such a Norwood 5 type of patient, despite all that, I still think this is not a lost case. And we can also see it on his hair quality. I mean, obviously if the hair is shorter, you can see that the density is lagging and it's not looking that good, but once he lets the hair grow longer on the frontal third and then combs it backwards, Look, he can like camouflage a lot with it and make the hair look much better right away. So before we even start talking about another hair transplantation, which I think it's going to be possible for sure, because again, if we take a look at his donor, it still is looking good, and once the hair is grown longer on the donor, you cannot even notice that over harvesting that much. It's only when it's cut very short you can see these over harvested spots like white dots. And first of all, you need to start taking medication to keep these lateral humps, to keep that crown area from receding further. You don't want to become like a Norwood 6, because then it's going to be increasingly harder for you to cover all of these areas sufficiently, and it's going to be very harder for you like not to run out of your donor hair. So far so good, but I do suggest medication strongly. Finasteride, minoxidil, microneedling, and ketoconazole shampoo, at least to start with it. He mentioned he hasn't used anything. He used some type of serum or some treatment like lotion from the clinic 3 months after the surgery, but then he stopped. So he definitely needs to be consistent. So the suggestion number 1 would be medication. The suggestion number 2 would be giving FUT, follicular unit strip surgery, a serious consideration. Because if we take a look at his donor zone at the back from this angle, we can notice that although the lower portion has been over harvested, and also his sides, the occipital, the parietal zones are not that rich in donor hair compared to the occipital region, I do think that a skilled FUT surgeon could really utilize the occipital region very well and take a good amount of very healthy, thick follicles from it and use it for adding more density to his mid-scalp, even frontal third and mid-scalp, because I still think that his crown area is looking too full right now, and I would mainly focus on the mid-scalp and also repairing the frontal third a little bit because it's looking also too robust and pluggy. There will be a bunch of multiple grafts in the hairline, so it's not looking the most natural either, unfortunately. So he could also consider some partial removal of maybe the first row of the hairline, maybe several hundred follicles, and then having a natural placement done later on. And if he would want to get like that SMP with the buzzed, transplanted hair and combine this into that whole look, it's very hard to do it with this pluggy looking follicles in the hairline, which with very high angles, because if you cut it short and buzz it, even the SMP will not be able to mask it. It will just always try to like stand up and grow like that, and it's not gonna look natural. You need hair that is falling flat to make that SMP and short transplanted hair look the most natural. Okay, so that would be my advice, but ideally I would still try to keep that hair as long as possible so he can camouflage and comb it over, because I think that he has that hair quality that could really pull it off very well, and that's why I wouldn't be doing any short hair SMP look right now. So my next advice would be to add more density to the mid-scalp zone and also a little bit on the crown. I mean, from here the crown looks more bald, but from these angles it actually doesn't look that bald. Again, if I zoom onto the crown, I still notice plenty of density. I mean, the density is not bad. We see the fuse thinning, we see that even the whorl pattern is preserved well. So for me, I wouldn't be rushing into like a large session on the crown, because for me doing a treatment is way less expensive. You can avoid the surgery, which should always be the last resort because it's more invasive than taking a treatment. You will need to go through shock loss, recovery, and you can avoid all that by taking medication and thickening that hair on the crown with minoxidil, finasteride. Now many doctors are prescribing even the oral minoxidil and oral finasteride blends, which are very effective, and many guys are already taking advantage of that. And again, you can see how that hair from the frontal third, he can just grow it very long and slick it back. I would be also trying to get rid of these corners on the left and right area, because they are adding to the most unnaturalness on the hairline. There are many robust looking doubles and multiples in these zones. I'm not saying they're not on the hairline, okay? On the hairline they're also there, but if they are on the frontotemporal transition, it's looking the worst, okay? So I would be getting rid of them, and I would have some grafts added here, and then during another surgery I would have maybe some singles placed in the front again to refine the hairline as a whole, plus maybe do a little minor touch up on the mid scalp or crown if necessary. But I think by removing the worst looking grafts, the pluggiest looking grafts from this zone, he will already soften the hairline without even needing new grafts to be placed in the hairline. I think it's gonna already look much better and softer, so this will already help. And to be honest, with this type of before situation, he should have given FUT a more serious consideration, especially if you are already Norwood 5 and you are kind of maybe having even that Norwood 6 potential. You are not on a treatment. You should have gone with FUT instead, because you could have utilized the donor area better with that FUE and FUT combination. If you go to a clinic like Dr. Zarev in Bulgaria, who is utilizing very small punches like 0.5, 0.6 millimeter, obviously you could have started and ended with FUE all the way. But if you go to an unprofessional clinic that doesn't even know what's proper donor area management, utilizes bigger punches, your donor will not be utilized as great. And even if you have a good donor supply initially, they can pretty much destroy it and will not, the donor is not in the best hands. And the first time I was having a look at his donor when the barber was combing it, when the hair was very long, I was actually thinking, wait, this guy could actually maybe get a FUT as long as his laxity, the flexibility of the donor area, would be pretty okay, because I was seeing that fullness and pretty good density when the hair is long. Because you know that FUT, with its small transaction rate and really good graft survival rate, could really give him that high yield of very permanent grafts, and that would be very efficient way of transplanting for the second surgery. However, when we take a look at his donor when it's shaved, we will notice how bad the damage actually is. And if we imagine taking a strip from this donor, we wouldn't really get such a high yield of grafts, because we see how over-harvested it is. And potential scar from FUT, in my opinion, it wouldn't be worth the graft yield which would be able to be obtained via that strip. So in my opinion, the best way would be to just proceed with multiple small FUEs combined with body hair transplants, because we see that he has a very, very good body hair supply, fortunately, on his chin, underneath his chin, but probably also on the chest. So this is the way how I would go about totally like depleting his donor overall, step by step, until it's not gonna be possible any further. But again, he has that advantage of his hair being pretty thick and providing nice coverage even despite all that over harvesting. So once the hair grows longer on the donor, he can actually cover it up and camouflage the over harvesting pretty well. Alright guys, thank you so much for watching this video. I hope you learned a lot from it, and you can apply it to your own research and how you plan your hair restoration. If you need some help, if you need my assistance, I will be happy to assist you and help you out one-on-one with the choice of your doctor, clinic, evaluating different alternatives and options you may have in terms of getting your hair back. And if you are interested, you can check out the link below, which says mattdominance.com/one-on-one consultation. One-on-one call with me. It's a 60-minute Zoom video call where I can help you out personally. See you next time in another video.